Hi everyone. I'm hoping that you can see me and you can hear me properly. And can you just say yes if you can hear me and see me? Yes? Okay. All right. Okay, great. So good to have you here, especially in this scary situation where everybody are trying to do their best to stay home and study, right? So I thought this would be a great hour for everybody to learn something new and something helpful, and would love to keep it that way, right? Stay safe, guys. And I know it's most of you guys probably, probably some of your family members are already working in the hospitals right now. And let's keep all of them in our prayers. And we nurses, are one of the most important, essential part of this team today. So let's make it happen. And I cannot wait to have all of you as RNs and helping out right there at the bedside. So this is a great opportunity. So, and hi, good to have you. I wish I could see you personally, but can't. But you can see me. And today I'm doing this webinar from my Houston house. So I'm so glad that in the middle of all these airline problems and everything, we landed safely. Me and my kids came. Today is the first week. Yeah, we came last Friday, and that's why I couldn't meet you on Friday because I was on the airplane. All right, so I'll be here. So settled in Houston right now, in Sugarland, and we'll see how that goes, right? Okay. So today I'm going to actually talk a little bit about the changes which are going on because of the COVID situation. And I know probably a lot of you have a lot of questions to ask, and we will try to answer the questions. I will try to answer the questions towards the last because I also want to do some questions review today. But I'm going to give you what I know so far, okay? And it is a change for a little time. So why the NCLEX RN exam is changed? I mean, there is a lot of assumption and there's a lot of wrong information which is spreading. So that's why I wanted to do this for everyone, so you guys get the correct information. Please know that these changes to NCLEX exam has been done for two reasons, only two reasons. And number one is to keep that social distance, okay, and to limit the time that the persons are interacting with each other. When you are going to a testing center, and if you have taken the NCLEX exam before, you know what I mean. When you go to the testing center, you are going to be sitting in that little cubicle kind of area with your laptop, and then there are so many people, in the next line, and there are people around you, right? And now we know social distancing is such an important thing to do. So the test centers are trying to minimize the time you are spending there as a student. So that is one major reason why they are, changing the NCLEX exam time. Okay, and the other thing is many Pearson centers or test centers or exam centers are actually closed because of this problem, the COVID problem. And that means many people had their exams canceled, right? Because they couldn't write on the centers which they have chosen. So because of that, whatever available centers, they want to make sure it is accommodating for more people. Okay, so these are the only two reasons why there is certain changes in the NCLEX exam time and questions, number of questions, not the content of the question, the number of questions. It is changed for a certain time limit, that is from March 25th, that is like 2 days back. So from March 25th until July 2020, July this year. Okay, so for those time period, only for that time, it is changed. and only the number of questions changed and the hours changed. Please know that the exam has not changed. Okay, if anybody is coming and telling you that the RN exam is going to be easier now because they need a lot of nurses and blah, 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 please remember it is not true. The RN exam, the passing standard, the difficulty level, the kind of questions you are going to get, the content from you are going to get, the critical thinking, the clinical judgment, everything stays the same. Okay, so I think this is the clearest I can tell you. So please don't let anybody misguide you saying that the exam is going to be easier now. No. The only things which are changed are instead of 75 minimum questions, it is now going to be 60 questions. And if you are into upper coaching from before, you already know that there are 15 dummy questions. Or we call it dummy questions, or I call it dummy questions, and they are also called known as pilot study items or test items. The ones which does not have the scores. And if you don't know what I am talking about, there is a blog in applaren.com. You can go to that and you can read about dummy questions there. Okay, I have written about this a few months back. So usually in the first 75 questions, there are 15 questions, 15 questions which are dummy questions, which does not get scored. Whether you get it right or wrong, it doesn't get scored. So what they just took that out, which means the 60 questions, the minimum 60 questions which you are going to get, all of them are going to be scored towards your pass or fail decision. So you don't have any more dummy questions, okay, on this time. Like from March 25th to July end, whatever 60 questions, the minimum 60 questions you are going to get, they are scored towards your passing or failing. So be very careful. All right. The other thing is the number of total questions decreased. You know how we always used to say it can be 6 hours or 265 questions, right? 265 was the maximum you could go, but now that is decreased to 130. Which means you have to make or you have to prove yourself above passing standard with maximum 130 questions. See, you had 265 questions before. Now it is only 130 questions. So you tell me, does that mean it's going to be any easier? No. Now we have to prove yourself better, right, in 130 questions. I'm hoping that it is clear to everyone. Are you understanding what I'm saying? You all can hear me properly, right? Because I just wanted to make sure that this information is coming across to you. Okay, and this is the truth. All right. So now remember, when you are preparing, for the exam, do not take it any lightly, because I had several students, actually, even people asking, we heard that the exam is going to be very liberal. No, it's not. The content is not changing. The passing standard is not changing. You have to work harder and prove yourself better now with lesser number of questions and no dummy questions. See that? So please study very good, very thoroughly before you jump into taking those dates for the exam and write. Okay. Let me just write down here some people. Please check. Your speaker phone as everyone else can hear. I'm just putting that here because some people cannot hear. Maybe they didn't have their speaker phone on or something. So just wanted to make sure. Okay. Thank you for that. And another thing is the time, like I said, it used to be 6 hours. Now it's only going to be 4 hours. So which means, when it is 6 hours, it will be harder for the test centers to accommodate more people, right? So right now they are doing it only 4 hours. So you have to, even if you don't get up to 130 questions, but if the 4 hours is over, you will be out. So please make sure that you do questions in in kind of a speed, like maybe like 1 to 2 minutes per questions, and go ahead with that rather than just waiting with one question for a long time. Okay, so 4 hours, when it is 4 hours, they will be able to accommodate, more students to do that. So this is a time, a challenging time when we need nurses. So the test centers cannot just stop everything. They want people to become RN, which is a good thing. And they're trying everything possible to make more accommodations for the people who are ready. Okay, now you know why the COVID update is right? Now you know why there is a change. Please remember, it is not to make the exam easier. It is to get the right people at the right time as soon as possible. So you have to study better. Okay, now don't take it any easy. All right, and another thing is, how we used to get the research questions after the exam. Like, for the 2023 update, there was a lot of research questions which were coming up, the new gen exams, but those questions you will not be getting because they don't want anybody to spend any extra time in the centers. Now, if you are someone who is planning to write the exam during this time, or if you are someone who is not sure if you need to write or not, please make sure that you are prepared. If you are prepared 100%, then you are okay. You can go and write. It doesn't matter whether it is 60 questions or 130 questions, right? Because you are ready. Now, how do you know you are ready? When you did the Apple RN course, and if you did the exit exams, and if you have received like around 75% or above on the exit exam, which is on the lesson 39 and lesson 40, then you should be okay. If not, try harder. All right. Okay. So I hope that much is clear to everyone. So please remember that, these changes may continue. Okay. We don't know because as of now, we don't know how COVID is going to, react, how things are going to end up. So we are still worried about that. And but as of now, they said up till until July 2020. So as of now, that's all we have. Okay, they might postpone it. They might, this might continue for some more months, but we don't know yet. Well, everybody are, taking it one day at a time because this is something new for everyone, right? Okay, so any questions on this thing? If there is any small questions, I can answer right now. If not, keep it with you. We will deal with it afterwards. Okay. All right. And to summarize, you have to study. That's all I'm trying to tell you. It's not going to be any easier. All right, guys. So let's do one question today and let's go and, study some stuff. And this I have posted in the Facebook too. If you have seen, if you have been, if you have liked the Facebook page, sometimes we put questions there, and this was one of the questions. And I think I also posted the answers to this question, but I haven't given much explanation because I was hoping that I can explain better during this webinar. So this is the question, okay? It's a select all that apply question. The nurse is assessing a patient admitted with schizophrenia. Which of the following can be documented as negative symptom of the disease? Symptom or symptoms, because it's a select all that apply question. So there can be one, or there can be all, or there can be anything in between, right? So just see which one can be documented as negative symptoms. Now, number 1, patient is having trouble concentrating. Number 2, patient is having anhedonia. 3, patient is having monosyllabic speech. Number 4, patient is having flat affect. Number 5, patient is having auditory hallucinations. And number 6, patient is having associality. Now, there are 6 options here. Whichever you think is considered to be a negative symptom, I will let you guys actually type in here. Okay. Usually we don't do this. Usually we have, survey coming up. But for now, to make it easier, because there's a lot of people today, and it's not just our enrolled students. It is open to everyone who is interested, because you all are stuck at home, and I wanted to help you out with some questions because you're preparing for NCLEX. So just go ahead and type in whatever you think is the correct answers, okay? And for those of you who are our students, enrolled students, you will be getting this webinar recording like usual in our lesson 42. But please give 2-3 days, okay? I mean, it will come within that time. Okay. So most of the people are answering. I see that somebody answered all the above, and we'll let everybody, think about it. Okay. All right. Okay, so many people are answering. I'm just going to talk about this a little bit more. In schizophrenia, there are 2 kinds of symptoms which you should be really thorough with. Okay, because these kind of questions are asked in NCLEX, so you have to be thorough or know how to differentiate between these 2. Okay, and in the class which I talked about this, the negative symptoms and the positive symptoms. Now, remember, even though when we say negative symptoms, we think about something bad. And when we think about positive symptoms, we think about something good, right? Because the meaning of negative and positive comes to our mind like that. When somebody is positive, we think of them as somebody nice and happy. And when we are thinking about something negative, we think about that person as, they are like, angry or sad or something like that, right? But when it comes to schizophrenia symptoms, it's a little different. Okay, when we say positive symptoms, that means usually the people don't have it, but this person has it. That is positive symptom. When we say negative symptom, it's mostly like what normal people don't have it, or when normal people have it, these people don't have it. I will explain that better to you by giving this slide, and then we will come back to this question because it can be a little confusing. Okay, so here is what you need to know. The answer is 2, 3, 4, 6, but we will come back to it. Okay, it's not all the above. Here, by the way, you can click on my, that little video where you are seeing me. You can click on it and drag it. Okay, so that you can see properly. All right. So when it comes to positive symptoms, these are things which are which start happening. Like mostly a normal person don't have these kind of problems, but they start happening for them. Like delusions. A normal person don't have delusions, but now these schizophrenic people are starting to have delusions. I mean, they are seeing things which are not there. They are hearing things which are not there. They are having hallucinations. They are having auditory hallucinations. They are hearing things which are actually not there. They are, they are feeling like, ants crawling or something like that, which is not there. In a normal, I mean, if you look at them, it's not there. You cannot see it, but the patient is actually feeling it. So when something that is starting to happen, that is called positive symptoms. It has nothing to do with positivity. Okay, please remember that. So delusions and hallucinations and trouble concentrating and movement disorder. Okay, so those kind of difficulty problem, movement disorders means like it can be catatonia. Catatonia means, or waxy flexibility, like people are having that same kind of position. They cannot change the position. So those kind of things, and they might have difficulty walking. Okay, they might have, they just want to sit somewhere. They just want to lay down all the time. So those kind of things. which a normal person don't have it, but these people with schizophrenia starting to have all that. They are feeling it, they are hearing it, they are seeing it. Now they cannot move. I mean, those kind of things. They're having difficulty walking. So those kind of things are called positive symptoms. Now, negative symptoms means they are deficit, which means they cannot express, like mainly flat affect. Flat affect means, usually when we say affect, we are talking about, the presentation in the face, right? So there is something different between mood and affect. We talk about that in psychiatry, in mental health. So in that one, you have to remember, mood is something, the emotion you feel. Like if I am really happy today, that is my mood. I'm happy. But my face should see, you should be able to see that on my face, that I'm smiling, or I can, you can see I'm happy. You can see it from my face. Those are the non-verbal clues which you can see. But what if I'm very, very sad, but I'm always like, smiling like that. Then my emotion is sadness, but my expression or my affect is, happy. That doesn't correlate, right? So when somebody has a flat affect, that means they are not able to express whatever emotion they are feeling. So that is lacking, that is deficit. Now that is a negative symptom. Okay, when somebody is having an emotion, but you are not able to express it, it is lacking, that is negative. So it's a little difficult to understand, probably, to make a differentiation, but the more you think about it, you will understand that. See, delusions, there is somebody is hearing something, that is something more coming up, right? It was not there, it started now. You are hearing things, that is something which is started. Okay, you are having trouble concentrating, that is something started. You are having problem with movement, that is something started. That when it is deficit from normal people, that is called negative symptoms. Like blank look, you are like just staring. There is no expressionless. There is no expression. So expressionless faces, flat affect, then your voice is not having that punch to it. You're not modulating the voice. If you ask them something, you're like, yeah, I'm okay. All right, I'm fine. I'm happy. How do I sound? It's my face is not giving you any happiness, and my sound is not giving you any happiness. That is deficit. I'm lacking that expression. Okay, and that is what we call negative symptom. Okay, monosyllabic speech means like when you ask them, something like, okay, I'm just going to take Rajdeep and Rachel. So I'm asking Rajdeep and Rachel, so how was your day? How are you feeling? And they're like, okay. That's monosyllabus. Or they're like, something like that. That means they are not at all expressing. That is negative. Okay, lack of interest in the world and other people. There are certain specific terms associated with that, and I'm going to tell you them. You have to probably write them down, because sometimes it will be there in the options and you need to know what does that mean. Okay, I will tell you that. And they don't want to talk to people. They are not interested in world. They don't want to feel any pressure. They don't do any hobbies. Nothing. It's like really bad situation. Okay, so there are some terms. Let me tell you that. One is called alogia. It's a poverty of speech. I think I have a better slide here. Yeah, here. Alogia means it's the inability to speak because of a mental deficit or mental confusion or aphasia. Please remember, this is different from any developmental disability a child usually has. Sometimes how children with developmental disabilities might not be able to speak properly. Maybe there are people with stroke, who has aphasia. Maybe they are not able to talk because of the brain damage they have, because of the stroke. Okay, that is different. Okay, Alogia is something the term which we use mostly in the psychiatric environment when somebody is not talking, somebody is not speaking because of mental confusion. Not because of other problems, not because of any developmental problems or stroke or anything like that, but because of mental illness or mental confusion. If they are not able to speak, that's when we use the term alogia. Okay, and the other one is asociality. Asociality means you don't want to see people. Right now, probably that's a good thing because we all are in a social isolation kind of thing. But that doesn't mean that we can call them or talk to them. I mean, you will talk, you will call, you will video call. I mean, we are doing it now. So these people who have asociality, they are not at all interested in seeing anyone. Not in person, not calling, nothing. Okay, so no social interaction. They usually prefer to be alone. So this is something which might come up when it comes to schizophrenia. Okay. Another one is avolition. It's a symptom of various forms of psychopathology, like no motivation, they don't initiate anything. I mean, they don't do any purposeful activities. They don't take care of their hygiene. Okay, they don't cook, they don't eat, they don't take care of anybody. If there is a mother who is having schizophrenia, she may not take care of her child. All those kinds of issues. That is called avolition. So alogia, asociality, avolition, these are things which can come under negative symptoms of schizophrenia. And there are some other, and this is another one in the option, it was here, anhedonia. Okay, anhedonia means apparent inability to show or feel pleasure. So they won't do anything to make themselves happy. Not even a coffee. Coffee usually makes you happy, right? I mean, so that is also important. Okay, all right. So here, Olivia is saying she's losing me. I think it's the video. Is anybody else having trouble? Can you guys see me? Sally, Salma, Sarah. I'm just calling them names here. TG, can you see me? I just wanted to make sure. Okay. So you guys can see me. Good, great. Okay. Just wanted to make sure I'm not going from here. Okay. All right. So the answer here, now let's see. Number one, remember, first of all, it says negative symptoms, right? So when it says negative symptoms, we are going to talk about the deficit part of it. Okay, so having trouble concentrating is something new which is happening, which is there. Like, remember, it comes under our positive symptoms, things that might start happening. Trouble concentrating, that is a positive symptom. It's not a negative symptom. And because of that, 1 is not going to be our answer. But 2, yeah, it's a deficit. 3, patient is having monosyllabic speech. Yes, if you're not talking, so saying that, yeah, no, okay, those kind of things, those are not good. So that is negative symptom. Having flat affect, negative symptom. Having auditory hallucinations, remember, those are things started happening more, right? So that is not a negative symptom. It's a positive symptoms. So that is not going to be our answer. And the last one, yes, that's our answer. Patient is having asociality. Okay, because number 2 is a deficit, number 3 is a deficit, number 4 is a deficit, and the 6 is a deficit. So our answer is going to be 2, 3, 4, and 6. All right. Even though all the things which are given here can be present in schizophrenia, like if the question was about what are the things which can be present, or what are the signs and symptoms or clinical manifestations which can be expected in a patient with schizophrenia, then the answer will be all the above. But here, it just really clearly says what are the negative symptoms. So we have to focus only on that. Got it? So that's why we have this, okay? Saj is asking, what about autism? Autism is not a mental problem. It's actually a developmental issue, right? So we talk about autism in our lessons. Some of these things can be present in autism, but we don't want to call it as a psychiatric illness. It is not. Okay, that's a cognitive problem, developmental problem. Okay. So autism is going to be, it's not going to be related to schizophrenia now. Okay. All right. Two different things. All right, guys. All right, are you ready to move? Let's discuss one more question here because I want to really talk about more questions and application. Content is really good. You can learn theory, you can learn content, but it's also very important that you know how to apply. And that's why I don't recommend any textbooks, because textbooks will help you to learn the theory, but only halfway. Okay, all right, let's do another question. A type 1 diabetic patient is admitted in ER with blood sugar of 423 milligram per dl. Woo, that's high. Diabetic ketoacidosis is suspected. Well, of course, the type 1 diabetic, right? So diabetic ketoacidosis is suspected. Which of the following orders should the nurse implement first? Okay, so it says, which of the following should the nurse implement first? Number 1, administer regular insulin as IV infusion drip, or using an IV infusion pump. Second, administer normal saline IV. 3, administer potassium chloride IV piggyback. And 4, keep the patient NPO. So 4 options. And I can see that some people already started answering, but I want everybody to go through the options and and see if which is the correct one. Okay, so it's a type 1 diabetic patient and the blood sugar is 423. That is really high for a type 1. And when it comes to type 2, sometimes people have like 600s and 700s, and you will see that, because in type 2, it's gradually increases. But in type 1, even 423 can be really bad. And, in diabetic ketoacidosis, I think most of you already know about that. It's a very bad complication when it comes to type 1 diabetes, right? So the question here is a priority question. It asks you here, which of the following orders should the nurse implement first? So what is the first thing you are going to do? Okay. Now I have talked about this in our class, especially in endocrine. So I'm hoping that most people are going to get this correct. But because there are other people here, I want to discuss this a little bit more. All right. Okay, so I can see that most people are answering 2, and there are some 3s and there are some 1s, which is quite understandable. And I don't think anybody said 4 or to keep them NPO, which is a good thing. Especially 4 is not the answer. Even if somebody is diabetic ketoacidosis, even if their blood sugar is high, doesn't mean that you are going to keep them NPO, right? You cannot just leave them NPO. We have to take care of the things. So definitely we can eliminate option number 4. We are not going to keep them NPO, but there are some new things which can do better. Now, before we come back to the options, I want to talk about what is the most important thing to do when you have a patient who should be going on insulin drip. And I think most of you will agree with me that this patient will surely need insulin drip, right? Now, is that going to be the first thing to do? That is a different question. But we all agree that with the sugar level of 423 for type 1 diabetes, definitely this patient will need insulin. Okay, but let's come back to it and see if that is the priority or not. So this is what I want you to remember, or I want you to know, that in diabetic ketoacidosis, you have to think about dehydration first. Okay, very, very, very important that we rehydrate. Let me write that down. Oh, yeah, it's here. It's here in the bold letters. You can see that. Rehydration, that is the most important thing when a patient comes with diabetic ketoacidosis. So always make sure to rehydrate the patient first before you start your insulin drip. I agree with you. We need insulin. This patient is quite high blood sugar. I mean, he is having problem. He or she is having problems. I understand that. But we have to make sure that there is enough rehydration before we start giving insulin, especially IV insulin. Okay, so prior to start, IV fluid. Normal saline IV is the first thing to do, which I think is the correct answer is number 2, but we will come back to it. Okay, now why we are saying there is a need for rehydration? Why is it important? That is because cerebral edema and increased intracranial pressure may occur if the glucose level falls too fast. So we don't want the glucose to go down too fast. You don't want people to have brain herniation. You don't want a diabetic ketoacidosis patient to go into, a coma or vegetative problems or, so many different complications because of increased intracranial pressure, right? And we don't want to be the ones who are going to send the patient that way. So definitely the first thing to do, the safest thing to do is to rehydrate the patient first, give them IV fluid, give them normal saline, and then you will start giving insulin IV drip. Now, when you're giving insulin or insulin infusion, usually it is done in a more critical kind of setting, like in an ICU or somewhere where more close monitoring can happen. So when you do that, please make sure to use an IV pump. Do not do manual thing for insulin infusion. Insulin infusion should always happen with infusion pump. All right. And also we have in the option, there is something about potassium. So it says administer potassium chloride IV piggyback. We might end up doing that, but that may not be the first thing to do. Because once you start giving the insulin, the potassium might come down. So yes, we might end up giving potassium. We will be monitoring potassium level. Okay, because when the insulin is there, the potassium will also shift. So it's very likely that the potassium level is going to go down, and it is very likely that you will end up giving a piggyback potassium chloride, which means you are never going to give potassium directly IV. You should always give it by, diluting it, right? And most of the times, the pharmacy will always dilute it and give it to you as a piggyback solution. So it's okay to use it, but we have to do the first things first. Okay, so out of these options, the best thing to do or implement first is administer normal saline IV, and then I will be giving regular insulin. And remember, regular insulin is the only insulin we are going to give IV. Okay, and then if the potassium goes down, which you expect, then you will be giving potassium chloride. All right, so the correct answer is, let me just write it down in case somebody cannot hear me or something. The correct answer is 2. All right, learn something? All right, guys, so let's go. And there is another question I want to talk about. Let me get that here. There we go. A 38-week pregnant client positive for HIV has been brought to labor and delivery. Which of the following is the best method for fetal wellness assessment? There's a clue here, and that is she is 38-week pregnant and she is HIV positive. So number 1, internal fetal monitoring as mother is nearing labor. 38-week is some kind of term, right? And number 2, external fetal monitoring. Number 3, contraction stress test. And number 4, abdominal ultrasound. Okay. So I will let you guys choose. It's a 38-week pregnant client. positive for HIV has been brought to labor and delivery. Which of the following is the best method for fetal wellness assessment? Okay, so I see that most of you guys are answering, and for this question, I want to do the process of elimination. And if this is something new to you, just listen to me, okay? This is very easy. What we do in process of elimination is we are trying to take out the worst things, or which we know for sure is not the correct answer. Now, the clue here is she is HIV positive. Now, when somebody is HIV positive, a mother who comes with HIV positive status, you don't want to risk the baby to get that virus, right? So you don't want the transmission of HIV from the mother to the baby, because there is a likely chance that the baby is not HIV positive yet. So you don't want to be the one who is introducing that, transmission. So we have to make sure that we avoid doing anything which might end up in an injury or blood flow or anything like that. So internal fetal monitoring is out. We don't want to do internal fetal monitoring. Okay, because in internal fetal monitoring, you will be entering through the pervaginal area, and you will be putting the electrodes directly on the baby's head. No. Okay, so you don't want to do that transmission there. So 1 is definitely out. Okay, now 4 is also out, because 4 is, abdominal ultrasound. I mean, that's not going to be the best thing to do to see the fetal wellness at this time when she's kind of in the, labor. I mean, you can do abdominal ultrasound and it's not specific, right? They are not saying that anything more about specific to, the baby's wellness or the fetal wellness. Okay, because in abdominal ultrasound, you will be able to see the movement and everything, but you may not be able to count how many times the baby is moving. You may not be able to see the heart rate variations that much, right? So when you think about all that, 4 is kind of a general thing to do. Not very good for this condition. Now, contraction stress test, no, because in contraction stress test, what you are going to do is you are going to introduce, or you are going to induce the labor, kind of like you are going to induce that contractions. You might give medications, you might give like oxytocin or pitocin, you might give that, or in contraction stress test, we might do nipple stimulation. So you are actually stimulating the uterus to for the contractions. You don't want that when somebody is HIV positive, because the best thing to do in HIV positive is a controlled C-section. Okay, so in that case, you don't want to stimulate any contractions. So if we don't know, we're sure that it's not 1, it's not 3, it's not 4, then obviously the best answer we have is number 2. So it's external fetal monitoring. I mean, sometimes it might say, like a non-stress test, even if they say that, it should be okay. But because in that you're, putting those electrodes, and you're monitoring the heart rate, and you are monitoring the fetal heart activity, and what is the relation between the activity and the heart rate. We talk about non-stress test and contraction stress test a lot in maternity. So I'm not going into details, but as of now, from these options, 2 is the best answer possible. Okay, so and that is because she is HIV positive. Now, it's a different story if the HIV status was not there. Then maybe, if it's a 38-week pregnant client, and if she already ruptured her membranes, internal fetal monitoring is a good thing to do. But when it is HIV positive, we don't want to do that. We don't want to do any episiotomy. We don't want to do any forceps delivery. We don't want to do any vacuum delivery. We don't want to do any internal fetal monitoring, nothing. Okay, because we are trying to minimize the exposure of the mother's body fluid to the baby. Okay, all right. So 2 is the best answer. All right, guys. So ready for some more challenge? Here we go. See, I'm not even giving you the time to answer, right? Like, are you ready or not? I'm already putting it out there because I want to take the best out of the 1 hour we have. Okay, Alex is asking something regarding the previous question. How is potassium and insulin related? That's a huge thing, and it is very well explained when it comes to endocrine system. Okay, so if you are in, you're going to our course in day 23, there's a huge explanation on that. Okay, this time won't be enough for me to explain that. Sorry about that, but you will find it in endocrine. Okay, all right, dear. Here, the nurse is preparing to witness client's signature on a surgical consent for cholecystectomy. The client says, I'm not clear on what is included in the low-fat diet that I will be on after surgery. What is the best action by the nurse? Number 1, call the doctor to come and talk to the client. Number 2, refuse to witness the signature on the consent. Number 3, teach the client about low-fat diet. Number 4, tell the client that the doctor will explain it after surgery. Okay, so it's a nurse preparing to witness the client's signature on a surgical consent for cholecystectomy. And I'm sure everybody knows what cholecystectomy is, right? You're going to remove the gallbladder, right? And then the client says, and you're going with this paper where the patient can witness it and the patient can sign it. And the patient is telling you, oh, you know what? I don't know. I'm not clear about what is included in that low-fat diet, which I'm going to be after surgery, and what is the best thing to do. And this is from legal and ethics, and we discussed this in detail in lesson 1 of our course, right? And I think most of my students are already answering it correct. I'm very proud of you. I have been seeing that. I mean, those of you who are already enrolled, you are getting everything correct, and I'm proud of you guys. I wish I could, just see you guys and just talk to you personally right through this, but at least you get to see me, right? So that's good. Okay, so here we go. Number 1, call the doctor to come and talk to the client. Number 2, refuse to witness the signature on the consent. Number 3, teach the patient about low-fat diet. And 4, tell the client that the doctor will explain it after surgery. Okay. Now, regarding legal and ethics, or regarding the consent, witnessing, signature, and all those kind of things, there are 2 major things you need to remember. We nurses are not the one who is going to explain the major things about the surgery, like how the surgery is done, or what kind of incisions are made, or what are the other available options other than surgery, or what are the medications they are going to give during surgery, or who is going to perform and who is going to be in the team, or what is the prognosis after the surgery, or all those things. We nurses don't explain them. Those things are supposed to be explained by the physician, by the doctor, by the surgeon who actually conduct the surgery. Okay, and when the surgeon explains that, the patient is supposed to tell the doctor that, okay, I got it. I'm giving you the consent. Let's go forward with the surgery, and then informed consent is taken. We go to witness the signature. What we are supposed to do is we are supposed to make sure that they understood everything. But there are some things we can explain. There are certain things which will be within the scope of nursing practice. Okay. Now, American Nurses Association has laid down real clear instructions on that. There are so many things we can do within the scope of practice. But there are so many things we cannot do because they are out of our practice. Okay. Now, explaining about a diet or teaching about a low-fat diet is something a nurse can do. That is within the scope of practice. Okay. If it is about an in-syndic spirometry, how to use it, you can explain. Yes, it is within your scope of practice. If this is about how to take care of the Foley catheter, yes, you can explain. If this is about, how to do passive range of motion, yes, you can explain. If it is something about TED hose, elastic stockings, you can explain. If it is something about splinting the incision while coughing, yes, you can explain. But if this is about how good the surgery is going to be, no, that's not in your practice. If this is about should I go for the surgery or should I take medicines and just wait for some time, no, that is not for you to decide. Okay, so in this question, because the patient is asking something within the scope of practice of the nurse, you can go ahead and teach the client about the low-fat diet. So the answer to this question is going to be number 3. Okay, teach the client about low-fat diet. Now, if this patient was asking something else, like I said, about prognosis or about team or surgery incision or something like that, then I will call the doctor to come and talk to the client. Okay, if it is something like that, I will not let them witness. I will not let them consent. I want to make sure that the patient understood everything first. Okay, so, and obviously 4 is not correct, because after surgery is not the time the doctor should be explaining everything. He should be explaining it before the surgery, right? So definitely 3 is the correct answer for us. Got it? Okay, now please make sure that you are very thorough with legal and ethics, because about 20-23% of your questions are going to be from management of care, and management of care includes legal and ethics and advanced directives and delegations and consent. Informed consent is a major part in it. And I think we spend lots of time explaining that in lesson 1. So please pay attention and learn completely. Okay, all right, here we go. Next one. An experienced staff nurse on a urology unit was asked to float to a pediatrics unit because the hospital census is high and they are understaffed. The staff nurse notified her charge nurse that she is willing to work with adults but do not feel confident to take care of pediatric clients. Which of the following is the best action to be taken by the charge nurse? Now you have to read the question at least twice, every time. Okay, do not jump into answers. Sometimes you must be lucky and get it right, but don't do that foolishness. Always read the entire question at least twice. Always read the entire options. Even if you read the first one and you know that is the correct answer, please don't click and submit. Go through all the options. Okay. So an experienced staff nurse on a urology unit was asked to float to a pediatric unit because they need them. And the staff nurse has notified her charge nurse, the one who was supposed to float. She told the charge nurse that she's okay to work with the adults, but she's not confident with working with pediatrics. Sounds like me. I'm okay with working with adults, but pediatrics is not my area. So now, which of the following actions or which of the following options, one is the best action to be taken by the charge nurse? Number 1, affirm to the staff nurse that she is experienced to take care of pediatric patients because she's an experienced staff nurse probably. 2, inform the pediatric unit that float nurse will not be available from urology. Number 3, complete an incident report that staff nurse refused to take up the assignment. Number 4, coordinate with medical surgical unit to send another nurse to pediatric unit with the urology staff nurse floating to adult med-surg unit. I think most of you know what is the best answer to this. You are correct. Okay. See, the thing is, in this one, maybe you will be able to answer it more easily, but remember the principle behind it. Okay, the correct answer is 4. Okay, that is the correct answer. But there are certain principles I want you to remember, because either way, whatever way the question comes, you should be able to answer it if you know the principles behind it. Okay. Number 1, if a staff nurse is telling the charge nurse that she is not confident enough to do something, do not push them, because that involves the safety of the pediatric patients. Now, what if the number 1 is going on? What if the charge nurse is telling the staff nurse, that, oh, you know what, you are ready, you are experienced nurse, you have the experience, and this is, not nothing. I mean, they are not going to give you anything which is very complicated. So just take care of the kids. You have kids, right? So you can take care of the kids there. I mean, if the charge nurse is saying that, let's say the charge nurse said that, and let's say this nurse, this urology nurse, urology is like with renal and reproductive system. So if this urology nurse goes to a pediatric population and take care of, some babies, and God forbid something happen, the patient safety, big problem. Okay, so don't do that. Number 2, inform the pediatric unit that float nurse will not be available from urology. It's partly true. I mean, when you think about it, it's a correct statement, but that is not the best action. So if the charge nurse is just calling the pediatric unit and is telling them, you know what, we don't have anybody who is confident to come there, so no, nobody is coming. I mean, that is abandonment. You cannot work like that when you are in a hospital. Even if it is not your unit, the entire hospital, the patients are your responsibility, especially of a charge nurse. Right? So you have to make the adjustments or arrangements where there is some kind of, give and take between 2 units. And number 3, it says complete an incident report. Now, I mean, the charge nurse, when I think about the staff nurse, she is actually following the protocol. She's actually following the chain of command. See, the staff nurse did not go into complain about the charge nurse to, nurse manager or a director, right? The staff nurse, whenever the charge nurse told her that you need to go to the pediatric unit, the staff nurse expressed her concerns directly to the charge nurse. And that is the right way to do. Why I'm saying all this? Because in your actual questions, that point might help you to answer. Okay, so listen to everything carefully. Each point I am saying is going to help you to choose the correct answer in your actual exam. Right? So always follow the chain of command. Don't skip anybody. And for you as a staff nurse, the chain of command is going to be the charge. Okay. Now, what is the best thing to do? Get this urology staff nurse to a med-surg unit, because she's okay with taking care of adults. And from med-surg, somebody can go to a pediatrics, because they might be, I have been floated to pediatrics and I was so scared to go there. And I think, I talked to my charge nurse and they were able to make adjustments, because I'm really scared of pediatric population. All right, guys. So I guess we are already 1 hour. So I hope this was helpful for you. But there is something else I want to tell you before we close. Now, I know there's a lot of things going on in your life right now. There's a lot of challenges. There is a lot of people in your home, probably people who are supposed to be out working. Everybody are staying. And maybe there are some people you really don't want you to be in the house, because they are making you anxious and always asking you about, have you studied? Are you ready? Have you written the exam? Especially because there is a demand for nurse, and there is a lot of calls coming in, offering a lot of bonuses and everything for nurses right now. So I'm pretty sure there are people in your home or in your neighborhood who really wants to push you to write that exam and get that RN letters behind your name, so you can go and work. I understand that, but please focus, okay? You are very, very valuable, Okay, and don't try to do something to make somebody else happy. Okay, I mean, just be valuable to yourself, respect yourself, because God has made you with his own image, right? So you are very, very, very valuable. So don't mess it up because somebody else wants you to do something else. All right, write the exam when you are confident enough. Write the exam when you are ready to write the exam. Please remember that. And if somebody has to hear this from your house, call them. I'm telling you, all the people in the house, please don't pressurize your child. Okay, let him work it out. She or he needs time, and this is not easy. Please please listen to me. Please don't pressure my kids. All right, so let them study. They will become RN. You just support them, you just pray for them. That's what they need. So guys, do what you can with what you have. And obviously this is not probably the right time to do everything you want to do, but do the best you can. And I'm there. I'm going to be there all the time. I'm praying for you, and stay safe. And I also wanted to tell you this, that there's a 20% off going on for the online courses, because right now I know a lot of you guys you're not able to go out to the classrooms and study, and so online is going to be the best way for you to prepare. And there's lots of YouTube videos out there, and I will try to do more sessions like this if you like it. And you can like the Apple Facebook page, and you please do subscribe to the blog also. There's a lot of information in the blog which you will find them very helpful for your NCLEX preparation. Okay, so if you are going to write the exam any sooner, then use this opportunity to get 20%. Just put the coupon code COVID, and that will help you. Okay, and I will try to do more. I'm just coming out of the jet lag and everything, so and I'm loving this, and my office is just getting ready. It's not ready yet, but lots of stuff to do. But it's just been 1 week, so we'll do that. All right, guys, so take care, and I miss our on-site classes. I miss seeing you guys. I miss our sessions together. I miss the jogs and the fun times, and all the snacks we ate in between, right? So take care, and well, we'll see you again. And about the Houston on-site class, the plan is still to start in May. That was the plan all the time. Towards the end of May, we will be starting the classes. It will be in the Missouri City, Sugarland area, in the Houston area. And I don't have the address yet because of this COVID situation. Everything is kind of in the, lockdown situation here. So, but I'm hoping that by mid-May, everything will clear up. And by towards end of May, we will be starting classes. And I can't wait to have the on-site classroom and students, I can't wait to see you guys. So be safe, take care of yourself, drink lots of water. Hey, I have a new water bottle now. So, drink lots of water, and lots of vitamin C, and take care. All right, guys, bye-bye. See ya. Prayers.